many females, an orgasm is an important part of lovemaking and masturbation. For it, an intimate and relaxed environment with sexual arousal is necessary. During sexual arousal, the vagina becomes wet and blood flow increases. The vagina becomes darker in colour and the clitoris swells. The labia gets parted and turn outwards. The uterus and cervix are pulled up and backwards into the pelvis. This makes the vagina longer. Heartbeat, breathing, and body temperature rises. Sweating also occurs. Furthermore, the skin starts to glow and the breasts swell. The nipples become hard. In some women, the colour of their face, neck, and chest becomes red. The clitoris plays an important role in achieving an orgasm. Mostly, an orgasm can only be achieved by stimulating the clitoris directly. This can be done with hand, mouth, vibrator, and penis. Vaginal penetration causes the vagina to become narrowed, which results in more stimulation of the wall of the vagina and the clitoris. An orgasm happens at the peak point of arousal. The lower part of the vagina, the vaginal wall, the uterus and the sphincters around the anus and urethra contract forcefully and rhythmically. These contractions last for 1 to few seconds. The initial contractions are the most intense. Afterwards, the interval becomes longer progressively. In general, a woman can have about 10 to 15 contractions, which last from several seconds to a minute altogether. During the sexual climax, heavy sweating, goosebumps, and muscle contractions in hands and feet can occur. Some women also make noises as expression of pleasure. After the orgasm, a feeling of relaxation predominates. An orgasm is a very personal experience, with or without a partner. Some women prefer to be alone after an orgasm. Others are still so aroused that they can have another orgasm. This is called multiple orgasms.